MIRA NAIR. In preterm infants with retinopathy, long-term refractive outcomes. You are from which place?
Sorry, sir?
You are from which college?
Good morning. My study is on the long-term refractive outcomes in preterm infants with retinopathy of prematurity. Treatment modalities in ROP have changed over years. We have started from the cryotherapy, we have moved on to laser photocoagulation, intravitreal anti-VEGF, and combined intravitreal of anti-VEGF and laser photocoagulation in selected cases. Very few studies have compared the long-term refractive outcomes of each of these treatment modalities. Objective of my study is to compare the refractive outcome of preterm infants treated with anti-VEGF monotherapy versus laser photocoagulation versus combined anti-VEGF and laser photocoagulation versus spontaneously regressed ROP in a tertiary eye clinic. My study is a retrospective cohort study from a period of June 2020 to May 2022. Eyes of premature infants with retinopathy of prematurity diagnosed between 2016 and 2018 were included in my study. 72 eyes of 36 patients were included in my study. So for the purpose of the study, we have divided the infants into 4 groups, that is, based on the treatment they received, into group 1 having anti-VEGF injection alone, group 2 having laser photocoagulation alone, group 3 having anti-VEGF and laser photocoagulation, that is combined therapy, and group 4 having spontaneously regressed ROP without any treatment. So based on the ETROP guidelines as well as the stage and severity of the ROP, we have planned the treatment modalities, and following treatments were given, that is anti-VEGF with laser or laser photocoagulation alone, or no treatment in case of spontaneously regressed stage 1 or stage 2 disease. Anti-VEGF injections were not repeated in any of the patient in any eye, and these children were followed up annually with cycloplegic refraction and fundus examination. Longitudinal cycloplegic refraction were measured at each visit prospectively, and refractive error was recorded in the form of spherical equivalent. We have classified these infants based on the refractive error according to the literature into low myopia, high myopia, emmetropia, and astigmatism. The uncorrected visual acuity was measured with age-appropriate pediatric visual acuity charts in younger children and were converted into logMAR. Infants who had other congenital systemic or ocular abnormalities and infants who lost follow-up were excluded from the study. Statistical analysis was done using SPSS version 20. Coming to the results, 64% of the infants in my study group were male and 36% were females, and the other chart shows the distribution of males and females among the 4 groups. Mean gestational age of infants in the study group was 28.5 with a standard deviation of 3.83. Coming to the distribution of birth weight, there was a significant difference in the distribution of birth weight among the 4 groups with a p-value of 0.007, and spontaneous regression group had a highest mean birth weight. We also looked into the distribution of uncorrected visual acuity among the 4 study groups, and it was noted that infants treated with intravitreal anti-VEGF alone had a poor uncorrected visual acuity. Coming to the difference in the spherical equivalent among the 4 groups, it was noted that the anti-VEGF group had the highest spherical equivalent and spontaneous regression group having the lowest spherical equivalent. And we did a pairwise comparison among the 4 groups, and between the anti-VEGF and the spontaneous regression group, there was a significant difference with a p-value of 0.05. We also categorized the infants based on this refractive outcome into low myopia, high myopia, emmetropia, and we noted that high myopia was found to be more in the anti-VEGF alone group, followed by the anti-VEGF and the laser group, and there was no instance of high myopia in spontaneous regression group and highest amount of emmetropes in the spontaneous regression group. Also, the astigmatism was found to be highest in the anti-VEGF alone group, and it was lowest in the spontaneous regression group. We took the myopes among the 4 groups, and when we looked at the myopes among the 4 groups, it was noted that the injection combined group was having a higher spherical equivalent, and astigmatism was more in the injection alone group. We also looked into the association of various risk factors with the incidence of myopia, and it was noted that the multiple pregnancy, mechanical ventilation, history of sepsis, they were not found to have any statistical significance with the incidence of myopia. Also, the zone of ROP was not found to be significant with the incidence of myopia. Mean gestational age was also not statistically significant with the incidence of myopia, whereas mean birth weight, the incidence of myopia in infants with low birth weight was found to be statistically significant. We also looked into the stage and the incidence of myopia, and higher the stage of ROP, more was the myopia with a statistical significance of 0.004. Coming to the discussion, myopia associated with ROP have been studied since early 1950s, and Becher and Brandon were the first to analyze the ROP and myopia, and they postulated that it could be the underlying metabolic disturbance that is causing the change in the refractive component. Other postulates were the forward lens position, incomplete postnatal development of the crystalline lens, as well as retina being orchestrating the overall ocular growth and development. It can affect the scleral and corneal maturation, which will be affected in a premature retina. So in our study, we have noted that the stage of ROP and the amount of resultant myopia had a significant correlation. Zacharias and associate also have proved the same. And with the advent of anti-VEGF, it was thought that the incidence of myopia will be reduced when the infants were treated with anti-VEGF, but it was other recent studies have shown that it is not true. In our study also, we noted that the myopia was higher in the anti-VEGF and combined anti-VEGF and laser group. Chen et al. Has postulated that the inhibition of VEGF by the anti-VEGF may induce more apoptosis in the peripheral retina and subsequent dysregulation of emmetropization. So we compared our study with the other international study, and we noted that in our study, there was a similar incidence of myopia in our studies as well as Castellanos et al. Study, but in Chen et al. Study, the incidence of myopia was lesser. When we compared the infants treated with laser group, there was higher incidence of myopia in the other groups when compared to other study. This can be due to the diode laser used in their study and double frequency NDI laser used in our study. Also in the combined group also, there was a comparative result, but the incidence of myopia was more in the injection group in our study. Limitation of study, we have not measured the parameters like corneal curvature, structural parameters because of the uncooperativeness of the patient, which would have given us more structural information. So to conclude, in our study, we have a higher incidence of myopia in infants treated with anti-VEGF as well as the combined therapy. We also noted that there was a significant association between stage of ROP and myopia, and also as well as the mean gestational age and myopia. This suggests that prematurity itself, and higher the stage of ROP, more chance child developing myopia, and the treatment modalities may not be the only factor affecting the presence of myopia in these children on long-term follow-up. These are my references. Thank you for the patient listening.
Very nice presentation, but the problem, you told now spontaneous regression, you have observed some patients.
Yes, sir.
Which are that stage of ROP was
Stage
what?
1 and stage 2, sir, which have spontaneously regressed, sir, without any treatment.
Did they did have a plus sign or
No,
not?
sir. No signs of plus disease.
Achha.
Yes, sir.
Then you are told anti-VEGF can go in for myopia.
Yes, sir.
And you told something apoptosis. What's the rationale if that's combining? That
Sir, in the
and
study by Chen et al., they have found that the suppression of the anti-VEGF, suppression of the VEGF by the anti-VEGF was causing this apoptosis of the peripheral retina, which can be the cause of dysregulation of emmetropization.
What do you mean by that?
Because the retinal factors are the one which is contributing to the process of emmetropization. That is, several theories are there, sir. So, such as for the overall ocular development, for the structural development of the eye, we need factors from the retina. So, this is not happening in cases of premature retina. So, the anti-VEGF suppression, the VEGF suppression by the anti-VEGF may be causing that depression in that ocular factors which are needed for the normal maturation of the retina, normal maturation of the overall eye.
You are giving anti-VEGF because the patient has developed a prematurity.
Yes, sir.
If you allow it, then the patient may lose the vision.
Yes, sir.
That's why you have tried, no?
Yes, sir. But that may be the reason is what they are telling in the study, sir. We have also found that the incidence of myopia
was... What the dose of anti-VEGF you have given?
Sir, 0.05, sir.
0.05, what anti-VEGF?
We have some patients, almost 2-3 patients are having Avastin, and rest of the patients were ranibizumab, sir.
Ranibizumab?
Yes, sir.
The dose is same for both?
Yes, sir.
Dose?
Yeah. 0.1 mg per ml of ranibizumab and 0.05 ml of bevacizumab, sir.
Okay.
Only one injection was given?
Okay. Only one injection per patient, sir. No,
so
it was not.
Finally, do you think the incidence of myopia is due to the treatment or due to the prematurity or due to the severity?
It is not due to the treatment modality, because in cases of infants receiving anti-VEGF injection, the severity of the disease was more. In the zone 1, it will be in the zone 1 or zone 2 posterior. So it is because of that severity of ROP that is causing the myopia, resultant myopia, not the treatment modality.